You should come look up just a little bit.
Sorry.
Okay. All right. All right, so first of all, let's talk about your hip pain. Because you said it's on the left side, correct?
Yeah.
Okay, where do you feel that hip pain at? Can you point to me where you're feeling that exactly?
It's usually up here or sometimes on the side.
On the side.
And every once in a while on the front.
You'll feel it on that groin.
Yeah.
Okay. And so you're feeling it on this joint right along this area right over here.
Mm-hmm.
Okay. Now, I know we talked a lot about the hip pain. The shoulder pain, it's also on the left side?
Yeah.
Okay, where do you feel the shoulder pain at?
It's usually right here, on the inside.
Right inside that shoulder blade area?
But then I also had an accident, and so I feel it near the collarbone as well.
Right into here.
Yeah,
okay.
Right where it meets the collarbone.
So where they kind of combine together.
Yeah.
Okay. All right. So let's take a look. Yeah, we're getting quite a bit of stress on the upper back. Yeah, so right there, we're starting to see some stress. That needle just kind of flings through to that side. Yeah. Okay. Let's see. Okay, so we're seeing a couple spots pretty close together here. So we're going to have to decide which one do we want to work on and which one will we leave alone, because they're too close together that I don't really want to aggravate one if I adjust the other. But yeah, so that is more significant right on that upper part right over here. So I might be working on that today. But we'll take a look at which one's not moving better. More than likely, one's going to be a compensation, and one will be the actual problem here. Do you ever get any pain, numbness, or tingling in the left arm and hand, or no? Is it just shoulder pain?
Yeah, I do.
You do get some numbness down there as well? Right there. Okay. We have a couple different spots. One is that L5. And then we do have some towards down into that sacrum, but it also could be that pelvis here.
Yeah, that actually hurts when you touch
We're going
it.
to push on right there?
Right to the left. Yeah,
here.
there.
Okay. So first we're going to take a look at what's going on with the neck.
Okay.
You do have some stress right in this area.
I have pain there as well.
Yeah, I do know you said you experienced, acid reflux and digestion as well, right? Okay.
Yeah.
That's been going on, you said, for a while as well?
Yeah.
Okay. Wow. You're so young and you have all these things going on.
I know.
So we got to do something for you. We got to really see how we can help. Right here. Tilting you back. You feeling pretty sore there? Yeah. 7, 6, and then that 5. Yeah. There's a lot of swelling on that joint too. You can feel how firm that is here. And then right here, how much softer that tissue is, because there's a lot of swelling in there. I want to tilt you over to that right side. Ooh, okay. Much more movement on that left side. Right there. 11, 10. That's where you feel T10. Okay. So yeah. So again, that's you're feeling that swelling just bundling, bogging up right into this area right there. Okay. So T10, we're going to be working on that. Based on your x-rays, I'm going to be seeing if that's going to clear up when I fix what's going on down below and what's happening up on top. We'll recheck T10 and see if we're going to adjust that. First things first, on that lower back, here's your upper joint, middle, and then your lower. Which is worse, upper, middle, and then lower? Any pain on those?
Probably the top one is the worst.
It's the worst.
And then the bottom is moderate.
Moderate down here?
Yeah.
Okay. Do you have any pain in the middle here? Not as much. More so up in here.
Yeah.
So checking out the pelvis, going to bring your knees out and then in. So just moving pretty consistently here. Okay, and then relax. Let's have you just move the right side only for me. And then the left side only. So the interesting thing is your left hip, even though you're feeling more pain on there, your right side's not moving as well.
Okay.
Actually, your right side's not moving as much as your left. What I'm actually going to do is take a look at your sacrum. Scoot back just a little bit. Yep, right there's fine. I want to tilt you back here. It's 5. S1. S2. 3. 2. And then 1. Any soreness on those?
On 1.
On 1. Mm-hmm. What about on 5 there? Not as much.
A bit, but definitely more on 1. Yeah.
Yeah. I'm thinking what we're going to do is adjust your sacrum.
Okay.
That can also impact some of that left pelvis, but oftentimes when your right hip's not moving, it can actually lead to further aggravation on that left side because it's overworked and it's overmoving. So if I can work on the pelvis or the sacrum, that's going to help to stabilize the foundation, get some stress off of the spine going to the left, and I think that's going to help to relieve some of that pain here. So I'm going to try to make this as easy as possible, but just based on the soreness and how much swelling in there, it can be just a little sore, okay?
Okay.
So this is going to be your C5. Relax in that shoulder, and as you relax in there, all you got to do is you can look up just a little bit.
Sorry.
Okay. All right. Good. You're okay. Deep breath for me. And all the way out. Let it go. Breathing in again. All the way out. Good. One more time. And then all the way out. Good. That was a pretty good adjustment, huh?
Yeah.
Yeah. You've been adjusted before though, right?
Not like that.
No?
No, always on the table.
Yeah, so you can tell it's a little deeper. So you're going to relax that shoulder. And as you relax, there you go, drop that shoulder. Good. Little push right. A little bit more. Good. Wonderful. Alright. Okay. And actually swing the arms a bit more.
Okay.
Good. What I'm actually doing is I'm trying to move some of the inflammation from the joint here. Okay. I'm actually going to want to try to do that one more time because we got a little bit of movement, but I want to see if I can get a little bit deeper set on that, okay? All right, so you can go and relax there. All right, so with this, I'm just going to give a little bit of a push right here, okay? So drop in that shoulder. As you drop that shoulder, and give a bit of a push right there. Good. No. Good. No. All right. And again, same thing, just give a bit of a push right here, okay? There it is, good. All right, coming up. All right, again, facing this way, I want you to just walk in and move your arms and your legs, okay? Good. I know it kind of feels funny just walking in place, but I want you to get some movement and get some of the inflammation pumping down that joint, okay? All right, well, that's looking much better. Good. Yeah, that's clearing up really good. So the good news is that's cleared up pretty good. There's a little bit, it's definitely decreased, so I actually want to leave that alone and see how you do with that. Yeah, that's much less. So I want to see how you respond with just that. And let me take a look at the sacrum here. Yeah, that's clearing up here. Good. So I'm going to tilt you back just a little bit. Okay. Taking a look how that's moving here. How does that S1 feel? Better?
It definitely feels better. It feels maybe a little sore still, but just slightly.
Yeah. No, it's moving a lot better too. So now the goal is, okay, let's get some movement in that joint, get some inflammation out of it, okay?
Yeah.
So we did a couple things here, right? The first thing we did was your C5. Okay, you can tell that was pretty sore. There was a lot of swelling. So once you damage that joint where it misaligns, you damage the tissues and the ligaments, and that will create swelling around that joint. So when I push into that joint, you're like, oh, that was really sore.
Yeah.
That's what you're feeling is when I'm pushing on that spine that's where you're feeling that. And that C5, basically you've lost that curve in the neck, and it basically pushes back on that joint, and you're getting a lot of the swelling in there. Okay, so we had to push that joint forward here. The other one we did, again, we did your tailbone, which is your sacrum, and you can see that this is connected to your left hip. and your spine, it's leaning out to that left side. So all your weight is compressing onto that side.
Yeah.
So we worked on your sacrum, which is the foundation, so we can start to stabilize the rest of the structure. Okay? Because I can chase the symptom and actually work on that. And you'll hear some popping. You might feel good for a little bit. But that's not what my goal is. I want to get more long-term stability there. So we worked on the tailbone or the sacrum just to stabilize the foundation. And then we'll see how you do when you come back in on your next appointment. See if that's doing a little bit better or if we need to keep working on that. Okay?
Sounds good.
All right. How are you feeling right now? You doing okay?
Feel good.
Good.
Yeah.
Good. I will bump. All right. Well, thank you for being here. I'm excited. We're going to see some good things for you.